This is 4-year-old Remy Rutherford, a bright and happy child from Simcoe, Ontario, but 22 days ago, his health took a major turn.
So he's had a lumbar puncture and he's had a bone marrow biopsy to confirm his diagnoses, which is that he had strep A, and that caused him to go septic. And then on top of that, he developed a rare condition called HLH.
Talking to Trending Now from Remy's hospital room, his mother Stephanie says the children's hospitals nearby in Hamilton and the one in London were over capacity. Their only option? Taking an air ambulance more than 350 kilometers away to Kingston General Hospital.
But I just want parents to keep Remy in mind when the next time they head to the polls and they have the chance to vote for Doug Ford, that they keep him in mind and they keep this whole story in mind. This is what happens when you have a government that does not put children first, and that's exactly what's happening.
Ontario's health minister was asked about the situation today.
When we have high numbers of pediatric patients, primarily because of the virus season that we are experiencing this winter, we have the opportunity through air ambulance, Orange, to make sure that where there is capacity within the Ontario health system, we get that access to the patient as quickly as possible.
Sylvia Jones praising the air transport system in place.
Look, I get it. It's not ideal as a family to have a child that far away, but it is also important to appreciate that by doing that air transport, that child was able to be assessed and treated sooner.
But the situation has been far from easy for the Rutherford family.
We should not have had to come 350 kilometers to get the care that Remy deserved.
Stephanie and her husband also have a 6-year-old daughter who remains in Simcoe with her dad, struggling with being apart from her mom and brother.
And she had kept saying that she felt like she had drawn a picture of us and that we just ripped her out of the picture. And I mean, as a parent, that it breaks my heart.
The hope is that Remy will be transferred to Sick Kids for more treatment and rehabilitation for his strep A diagnosis, but the Toronto Hospital has been dealing with a surge as well.
Over a few weeks, we started to have just massive numbers of people seeking beds here in the pediatric intensive care unit at Sick Kids to support otherwise healthy kids with acute respiratory illness, mostly from flu and RSV, and to the point where we started to not be able to accommodate all of those asks, and that led to the very frightening situation that we were going to start to have to leave kids in community hospitals where they weren't prepared to care for children who were that sick.
The high number of admissions prompted the hospital to make the difficult decision to cancel non-urgent surgeries and redeploy staff to critical care units. Instead of its one patient, one nurse model, specialized nurses from surgical units now work with an ICU nurse as they care for 3 patients or more.
We are at a breaking point. Things are very serious, and it's specifically for our children's hospital. Our children are at risk right now. Given how serious it is wrong that the Prime Minister of this country is not showing up to deal with this national crisis.
Federal NDP leader Jagmeet Singh calling for an emergency debate in Ottawa, citing several alarming developments. The Children's Hospital in Ottawa calling in support from the Canadian Red Cross last week to bolster the staff who are treating record numbers of babies and children with respiratory illnesses. The Alberta Children's Hospital in Calgary is using a heated trailer as an overflow waiting room. And in British Columbia, BC Children's Hospital is now allowing 2 patients to share rooms intended for just one.